Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Luce Community Health Center reporting for the week of March 29, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we are here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has over 83,000 cases and 1,399 COVID deaths. Fortunately, daily cases continue to come down from our wintertime spike, which peaked in the first half of January. And looking here at our 14-day average, we can see that cases are coming down and are now about where we were in October. Test positivity rates remain highest in East Oakland's 94621, 94603, and 94601 zip codes, and now also in the 94544 zip code in the Hayward area. So while cases continue coming down, they are not coming down the same for everyone. And what continues to be concerning about this is that we are seeing these high rates of cases, even though testing in these areas is lower than in other areas of the county. So you can see here that it's almost flipped, where the areas with the highest positivity rates are getting tested the least. So while we're encouraged by the decreasing positivity rates overall, we remain concerned about any blind spots we may have due to lower testing rates. Now, we know that even though case rates overall are coming down locally, there are also rising cases in several places around the world, including states right here in the U.S. So hopefully we have been learning some things in this pandemic and understand that another wave here is entirely possible. We know that there are more contagious and potentially more deadly strains among us, including the UK variant, which has been identified throughout California, including here in Alameda County. And simultaneously, we know that counties are entering less restrictive tiers, more people are traveling, and as more establishments, including schools and businesses, are reopening, there are more opportunities for mixing, which creates more opportunities for transmission. Now, while all of this is happening, we know that more adults are becoming vaccinated, causing some to perhaps let their guard down a bit, even before we hit that herd immunity. And we know that about 20% of the population here in Alameda County is under the age of 16 and therefore not eligible for the vaccine. So what about the children? Well, there seems to be good evidence now that the risk of a child contracting COVID is about the same as an adult. So if you put a child in the same setting with an individual that is COVID positive, they are just as likely to contract COVID as an adult. But the risk of getting severely ill or dying is much, much less in children than it is in adults. Now, as we know, many children have very mild COVID infections or even asymptomatic infections, meaning no symptoms at all. But it's what can happen next that is a cause for increasing concern. First, you may recall the severe inflammatory condition that can occur in a small percentage of children after getting COVID, MIS-C. And Dr. Aisha Mays went over this in detail in our February 16th briefing. But common symptoms of MIS-C include fever, abdominal pain, vomiting and diarrhea, neck pain, skin rashes, bloodshot eyes, or feeling extra tired, or even listlessness or extreme fatigue in children. And these tend to appear weeks after the initial COVID infection. So a child can have a mild case of COVID or even no symptoms at all, and then weeks later, MIS-C can manifest. So it's important to stay vigilant with children and have a low threshold for suspecting possible COVID and testing when you think there is exposure or symptoms. Now, there have been some recent reports among children with MIS-C that a higher percentage seem to be getting very ill. So an increasing proportion of those getting MIS-C are needing to be cared for in the ICU over the past couple of months compared to before. And we're not entirely sure what's going on here, whether this is a result of the more virulent strains or something else, but we will be keeping an eye on this as we learn more about MIS-C, more about why it's affecting some children and not others, and what we can do about it. In the meantime, the most important thing is to not let children catch COVID because you cannot get this more severe syndrome if you don't catch COVID-19 in the first place. Also, of increasing concern as it relates to COVID in children is long COVID. There has been increasing data pointing to the concern that long COVID is actually not that uncommon in children. And like with adults, it's entirely possible to get long COVID even after a very mild course of COVID, or even among those who never got symptoms of COVID. So the Office for National Statistics out of the UK reviewed survey data of over 9,000 people. And this is some data that is causing concern. So the data is suggesting that 13% of children under 11 and about 15% of those 12 to 16 reported at least one symptom 5 weeks after a confirmed COVID 19 infection. The most common symptoms overall at that 5 week mark were fatigue, cough, headache, loss of taste or smell, and muscle aches. And these percentages are high and do bring us concern around longer lasting impacts for children. And we have been hearing about children complaining of difficulty concentrating or brain fog. We've also been seeing in complaints of headaches as well as hair loss. There was a small study out of Italy that was a small preprint study that showed that 53% of those with confirmed COVID 19 had at least one symptom 4 months or more after their initial diagnosis. And here's another preprint study that actually took a deeper dive into those who reported having long COVID. They were really trying to get a better sense of what those individuals were experiencing. They looked at data from 510 children who had symptoms that were persisting for more than 4 weeks and found that the average duration of symptoms for these children was over 8 months. Their long COVID symptoms included fatigue, headache, muscle and joint pain, rashes, new heart palpitations, and also lack of concentration and short-term memory issues as well. There's also an analysis from here in California of about 1,400 patients that suggests that about 1/3 of people with long COVID were actually asymptomatic when they initially caught COVID, but then they went on to develop long COVID. And that is consistent with what we're seeing in the sense that how a person did with their initial infection does not help us predict who will get long COVID. So those who got very sick, went to the hospital are not necessarily the same people who get long COVID. And those with sometimes a very mild infection can get more serious symptoms with long COVID. So again, the most important thing here is to not let children catch COVID in the first place because you cannot get long COVID if you don't catch COVID-19. But knowing that some children will catch COVID and may have only a mild course, but then may go on to develop long COVID or even MIS-C, I think we all need to be paying close attention to the children. Do they seem overly fatigued or are they complaining of new symptoms like headaches? Do they seem like they're having a tough time concentrating or focusing? It may be worth testing for COVID or even for COVID antibodies to determine if the child is infected or was infected in the past. If there are unexplained symptoms, this may be worthwhile because if we know that a child had COVID in the past, we know that we're now concerned for maybe a 10 to 15% of long COVID. So again, we need to be paying close attention. Perhaps these children will need special accommodations, whether that's in the form of remote learning or allowing for a nap, for example. Certainly, children who have recovered from COVID-19 should be closely observed and supported. Now, basically, anyone who gets COVID-19 should get cleared from their primary care provider before resuming exercise or exertion. And for children, the American Academy of Pediatrics has some pretty specific recommendations for going back to sports after having COVID-19, even mild COVID-19. And the main reason for this is because we know that COVID can cause myocarditis. Myocarditis is inflammation of the heart, and it can be very dangerous to exert yourself if you have myocarditis. In fact, even children can experience sudden cardiac death due to exertion in the setting of myocarditis. So after COVID and before returning to sports, children must be assessed and cleared by their doctor. The American Heart Association has a 14-element screening that includes a host of questions and a physical exam. And if there's anything of concern, the physician may order an electrocardiogram, EKG, or lab test, respiratory function test, or even a pediatric cardiology referral. If there's nothing of concern, then there can be a gradual return to sports, a minimum of 10 days after symptoms onset, and also some period of time after the symptoms resolve. And how long after depends on how severe the initial infection was. This could be 10 days after symptoms resolve without having to take any medications. For more moderate cases and for more severe cases, this period could be 3 up to 6 months. And for those more severe cases, also cardiology follow-up will likely be needed regardless of whether there is a return to sports. And here's a helpful infographic from the British Journal of Sports Medicine that walks through what a gradual return could look like with increasing duration and intensity as the days go by after resolving COVID. Now, upon returning to sports, children will need to be monitored closely for symptoms. And symptoms of concern would include chest pain, shortness of breath that's out of proportion to what you might see after a respiratory tract infection, a new onset of heart palpitations, or passing out when returning to exercise. Any of these things occur, the child may need to go to the emergency room, but will certainly need to be reevaluated by the primary care provider and most likely will need a pediatric cardiology consultation. So as we can see, even though the risk of very severe illness and death may be small in children, there is a very real risk of long COVID and post-COVID issues. So the bottom line here is that we cannot forget about the children as it relates to COVID-19 itself. As more adults become vaccinated and start mixing with one another, and as school and sports activities resume, we cannot forget about the children. We really cannot say the children will be fine, they'll get over it, it will be mild. We don't know if that's always going to be the case. And I think now more than ever, it's important that we be vigilant. Currently, all children under 16 are unvaccinated and they're not eligible for vaccination and they are still at risk. One thing we think will be important is to have a very low threshold for suspecting COVID-19 and getting testing for COVID-19. Children with COVID may have very mild symptoms like congestion, a runny nose, sneezing, or just a mild cough. Parents, teachers, and coaches should be on the lookout for symptoms, even mild ones, and ensure that those children are tested for COVID-19. Not only will this help us to identify and stop the spread of COVID-19, but it will also clear up the picture for that child. It will help us be on the lookout for late reactions like that Miss C, as well as prolonged symptoms like long COVID. And it will help us understand what accommodations and interventions might be appropriate for that child. Likewise, parents, teachers, and coaches should be on the lookout for signs of long COVID, even if we're not sure if that child ever had COVID. If a child has unexplained fatigue, shortness of breath, headaches, or other symptoms of long COVID, they should check with their pediatrician. Pediatrician might want to do an antibody test to see if there's evidence of past infection. And of course, adults, including unvaccinated adults, should use caution that they do not carry or spread COVID-19 to others, including children. Now, vaccine trials are underway with all of the currently approved vaccines in the hopes that there will be an approved vaccine for children in the near future. But until then, we need to be thinking about all of the layers of protection that will be particularly important for unvaccinated individuals. And those include vaccination for all those who can be vaccinated, a properly fitting mask with adequate filtration, spacing, and we still think that 6 feet is ideal distancing, testing and quarantine. If you believe you were exposed and you've not been vaccinated, isolate yourself, get tested in 5 to 8 days, and continue to isolate until you get your results. If you get COVID-19 symptoms, get tested right away, even if you are fully vaccinated, and isolate until you get your results. And if you test positive, please do what you can to get your close contacts to get tested and isolate themselves as well. In addition, if you test positive, and this goes for many children who are at higher risk as well, you may be eligible for monoclonal antibody treatment, which is extremely effective in halting the progression of COVID-19 in certain higher risk groups, but it must be done early on. So this is another reason why it's very important to get tested at the first onset of symptoms. Continue to avoid crowded indoor spaces, and when you must be indoors with people other than your household, ensure that you have proper ventilation, which is fresh air circulation, usually by opening windows. Also filtration, and that is through your MERV filters or HEPA filters. Also disinfection and sanitization, and that is especially of high touch areas, but also for low touch surfaces as well. To optimize your own immune health, take a multivitamin and consider additional vitamin D supplementation. Attend to your mental wellness, manage your stress, and do what you can to get enough good quality sleep. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.